morning. Today discussion is about violence. Violence is defined by the World Health Organization. It's an intentional use of physical power, threatened or actual, against oneself, another, or against a group of community that either results in or has high likelihood of resulting in injury, death, psychological harm, and maldevelopment or deprivation. The definition emphasizes that person or group must intend to use force or power against another person or group in order to get classified as violent. Violence is thus distinguished from injury or harm that results from unintended action and incidents. The definition draws attention not only to the use of physical force, but also to the use of threatened or actual power. Such power or force may be used against oneself, against individual, against a group or community, as in gang violence or repression of ethnic group. Violence is here defined not only as a result of physical injury, but being present where it causes psychological harm. Maldevelopment or deprivation occurs, act of omission or neglect, and not only omission can therefore be categorized as violent. The violence is divided into three categories. According to WHO, has committed the violence self-directed, interpersonal, or collective, and into four further categories according to the nature of violence: physical, sexual, psychological, or involving deprivation or neglect. Many forms of violence may occur simultaneously, so they are not mutually exclusive. For example, intimate partner violence may involve psychological, physical, sexual abuse, and collective evidence often include the use of rape as weapon of war. Interpersonal violence. The interpersonal violence includes acts of violence and intimidation that occur between family members, between intimate partners, between individuals, whether or not they are known to one another, or there is violence not specifically intended to further the aim of any group or cause. This category includes child maltreatment, youth violence, some form of sexual violence, and abuse of elder. The International Classification of Disease used around the world to code mortality and morbidity include mechanism of injury code of assault, sexual assault, neglect and abandonment, maltreatment. These are sometimes grouped together and reported as interpersonal violence. The International Classification of Disease Code also exists for self-inflicted violence and injuries sustained through legal intervention or operation of war. The collective violence has been defined as instrumental use of violence by people who identify themselves as a member of a group against one another or set of individuals in order to achieve political, economic, or social objectives. Collective violence included war, terrorism, violent political conflict between or within the states, violence perpetrated by the state like genocide, torture, systemic abuse of human rights, and organized violent crimes such as gang warfare. It may include all categories of violence, be these physical, sexual, psychological, or characterized by neglect or discrimination. Sexual violence can occur at an interpersonal or collective level. Sexual violence incorporates non-consensual sex, contact, and non-consensual non-contact act of sexual nature, such as voyeurism, sexual harassment. Acts qualify as sexual violence if they are committed against someone who is unable to consent or refuse, for example, because of the age, disability, misuse of authority, violence, or threats of violence. Rape is defined as physically forced or otherwise coerced penetration, even if it's slight, of the vulva or the anus using the penis or other body parts or other object. Sexual coercion is defined as the act of forcing or attempting to force another individual through violence, threat, verbal insistence, deception, cultural expectation, or economic circumstances to engage in sexual behavior against his or her will. Gender-based violence. The gender-based violence therefore includes violence against women occurring within the family, geographically, culturally specific form of abuse, such as female genital mutilation, honor killing, dowry, regulated violence, as well as various forms of sexual violence, including rape during warfare, trafficking women, forced prostitution. As mentioned earlier, these latter examples may be forms of collective violence, where these abuses are directed not only against the individual, but against the entire group. This is particularly so when sexual and gender behavior violence are perpetrated in situations of conflict. Despite considerable attention, lack of widely used agreed definition of different forms of gender-based violence and violence against women, and the different ways in which these concepts are operationalized in research, limit the comparability of research finding. Intimate partner violence. Intimate partner violence refers to physical, sexual, psychological harm by current or former partner or spouse. This type of violence can occur among heterosexual, same-sex couple and does not require sexual intimacy. Although women can be violent against their male partner, violence may be found in male-to-male and female-to-female partnership. It is well accepted that the overwhelming burden of partners' violence around the world is borne by women at the hands of men. Feminist theorists have studied the link between masculinity and is used to bolster masculine entity, particularly in situations of poverty, and the implication of this for broader understanding of global violence. Domestic violence is often used interchangeably with intimate partner violence. Domestic violence includes physical abuse, verbal abuse, economic abuse, social abuse. Haggerty et al. Suggests that domestic violence can be better understood as a chronic syndrome characterized not only by episodes of physical violence, but also by emotional and psychological abuse the perpetrator used to maintain control over their partner. Family violence refers to child maltreatment, sibling violence, intimate partner violence, elderly abuse. The concept of family violence is increasingly being used to draw attention to how each of the subtypes of family violence may cause or be risk factor for other subtypes, and how there may be common underlying risk factor at the level of the family and the relationship between the family and wider community and society. In turn, suggest prevention opportunities that can help reduce the risk of all types of violence within the family and by depression, by addressing the family and social system. The interconnectedness of family violence, suicide, crime, drugs, alcohol abuse as manifestation of intergenerational trauma, and the importance of understanding historical context that produces family violence have been emphasized in Australia and indigenous communities there. Child maltreatment. Child maltreatment and abuse are sometimes used interchangeably. For example, WHO consultation on child abuse prevention used the following definition. Child abuse or maltreatment constitute all forms of physical, emotional ill-treatment, sexual abuse, neglect of treatment, commercial or other exploitation resulting in actual potential harm to the child's health and survival. Development or dignity in the context of relationship, responsibility, trust, or power. Some definition consider as abused those children who have been inadvertently harmed through the action of the parent or caregiver, while others require that harm to the child can be intended as should be intended for abuse have occurred. Given that these ideas about parenting are culturally contingent. Concept of what constitutes child maltreatment vary significantly between cultures. For example, corporal punishment for children is socially and legally accepted in many countries, while in others it is outlawed. Cultures continuously evolve, and so harmful culturally sanctioned practices have led to potential changes over time. Youth violence. Around the world, age is a significant risk factor for becoming both victim or perpetrator of violence, with the young male being particularly at risk. The World Health Organization defines youth violence as homicide, non-fatal attacks perpetrated by or against the person aged 10 to 29 years of age. The definition explicitly includes young people as both victim and perpetrator, emphasizing the increased exposure to violence to young people and experience they pass through stages of life. Elder abuse may be an act of commission or omission and may be intentional or unintentional. As with other forms of abuse, it may be physical, psychological, financial, sexual, or involve neglect. The International Network for the Prevention of Abuse in Elderly uses following definition: a single or repeated act or lack of appropriate action occurring within any relationship, where there is an expectation of a trust which causes harm or distress to an older person. Workplace violence. Workplace violence has received increased attention recently around the world. Definitions vary in the emphasis they place on the physical violence versus psychological violence. Recent work emphasizes the negative effect of both. International Labour Organization uses definition of workplace violence adapted from the European Commission. Incidents where staff are abused, threatened, assaulted in circumstances related to their work, including commuting to and from work, involving explicit or implicit challenges to their safety, health, and well-being. Bullying lacks consistent definition, but it's defined as persistent, rather isolated behavior. Bullying within the workplace may involve threats to the professional status, threat to personal standing, isolation, overwork, and destabilization. Within the healthcare professional, ambulance worker, nurses, workers with substantial face-to-face contact are particularly vulnerable to bullying. Harassment at work is any conduct based on age, disability, HIV status, sex, sexual orientation, or other factor that is unprocreated and unwanted and affect the dignity of the man or woman at work. Sexual harassment refers to where any form of unwanted verbal, non-verbal, physical conduct of sexual nature occur, with the purpose of the effect of violating the dignity of a person. In particular, when created an intimidating, hostile, degrading, humiliating, offensive environment. Structural violence refers to the physical, psychological harm that results from exploitive, unjust social, political, economic system. The apartheid system based on racial discrimination in South Africa is a classical case of structural violence, in which the state set in a place unjust law and system which disempowered, marginalized, disfranchised the majority of Black people. These and related human rights violations are significant social determinant of ill health. Structural violence is, however, often most pervasive because of its invisibility, embedded in ubiquitous social structure, normalized by stable institution and regular experience. Structural inequities usually seem ordinary. Farmers, for example, demonstrated the link between emergence and persistence of AIDS and TB in Haiti, and their disproportionate impact on the poor to the enduring effect of European expansion, slavery, and racism, economic dependence on the United States, attempt to erase or forget this from history. Forms of structural violence operate globally against women, children, indigenous people, and those in poverty. Structural violence may both underlie and be an outcome of modern armed conflict. This brings us to the end of the presentation. And as you can see, there are a wide range of violences that one has to be attentive to in order to keep a safe environment at work, at home, and with other people. Hope you enjoyed this presentation as much as I enjoyed preparing it. Have a great day.